Experts are warning of more pandemics to come. Free State University scientists believe COVID-19 is only a rehearsal for a bigger pandemic. They see humans' interaction with animals and lack of learning from the past are the reasons for this. Professor Robert Bragg from the Free State University joining us now via Skype. Prof, good morning. That's a very ominous warning. If you're telling us that what you are going through now with COVID-19 is like a dress rehearsal for something bigger, that would be worrisome. On what are you basing such an assertion?
Yes, well, good morning. Thank you for the opportunity to talk to you. You know, the pandemics or zoonotic diseases is definitely not something new. And we've had a number of them in the past century, like, for example, the 1918 influenza pandemic. And then we just cast our mind back to Ebola and a number of other serious disease outbreaks. So this COVID-19 is definitely a very, very serious pandemic, but it is not necessarily the worst that can come our way. Scientists for many years have been thinking about or talking about the possibilities of another influenza pandemic. And this is still, the possibility of an influenza pandemic is still very, very high on the possibilities. If you take, for example, the influenza virus in birds, the H5N1 virus. This virus is devastating in the poultry industry, but it also has crossed from chickens into humans. And when it has done that, it has had a 60% to 65% mortality rate. If you think about COVID-19, we're talking about a 4%, 5% mortality rate. So imagine a virus that spreads like COVID-19, that spreads before people are showing clinical signs, that has a mortality rate of 60 to 65%, and we could be in for a very, very serious pandemic.
And human-to-human transmission, as you said, would make it very, very serious. Behavior-wise, I mean, we should just stop eating meat then.
Well, you know, a lot of the pandemics that have occurred have all come from animals, basically. If you look at the 1918 pandemic, that started off in pigs. The Ebola started off in bats, just like the COVID-19, and started in bats. We have the SARS outbreak that was also a coronavirus, the forerunner of this one, and this was a coronavirus that also started in wet markets in China, and the animal in this case was a civet. And yeah, now we've got this coronavirus, which is believed to have started off in bats, but probably had a pangolin as the intermediate host.
But Prof, we shouldn't just blame, let's call it, exotic wild animal eating practices, like we know happens in parts of the world, including China, in this particular instance with the bat that you are talking about in Wuhan. I mean, we've had our own mad cow disease, and we still eat beef. We've had chicken issues, as you've pointed out, to the bird flu, but we still eat a lot of chicken. Is it that we need, in terms of preventing very serious pandemics, as you point out from your research, that we really need to reduce the demand for meat in the world?
Yes, this is very much where we need to start going. If you look at the massive factory farming, where you've got hundreds of millions of animals in close proximity, it's a breeding ground for diseases, and these diseases, as we know, can jump from animals to humans. So we need to seriously look at reducing the consumption of meat in the world. The other problem with consumption of huge amounts of meat is it's very harsh on the environment. The amounts of water, the amounts of food that's produced to produce meat, you could feed many, many, many people on the grains and the crops that are going into animal feed. So reduction of eating meat will certainly go a long way in reducing or mitigating the risks of these pandemics. But you know, these
But also we know, besides that, these viruses are forever changing, even those that live in animals, and even those that are now living in us in terms of human-to-human transmissions, like you've mentioned flu, for example, different types of influenza. Should we also be investing a lot more in understanding these types of zoonotic viruses?
Yes, definitely. You know, the scientific community in South Africa has the capabilities of doing these things. For example, we could in South Africa, if we had the financial backing and support, we would be able to make our own vaccine. We could make our own antibody fragments. We could make our own diagnostic kits if we had the financial support and backing to be able to do this. The technology is here. The world is very rapidly, if you think this coronavirus, which is obviously high in the news at this point in time, the scientific community only really found out about this virus in December last year. And there's already a massive amount of information that's available. But we still don't know that much about the virus. You know, the 1918 flu pandemic was probably the most devastating disease outbreak in humans. It's estimated between 50 and 100 million people died in that. And a lot of researchers around the world, prominent virologists, have been focusing on understanding how influenza virus works. And we know a lot about influenza virus. Yet we had the swine flu from Mexico a few years ago, which was exactly the same virus that caused the 1918 pandemic. And why that virus didn't kill 100 million people, we don't really know. So, yeah, the viruses, like you correctly say, the viruses mutate. Both influenza viruses and coronaviruses are RNA viruses.
It's very scary to know that. Yeah, it's very scary to know that it's really up to us, really, to change our behavior, to manage to make sure that we don't get something worse than COVID-19. But at this rate, we'll have to wait and see. Thank you very much, Professor, for your time this morning.